Evening once again. I came on live earlier on just to test run, and yesterday I was on Twitter Space, to moderate this same conversation on Twitter Space, and it was quite interesting. Yesterday we were all, were marking the World Physiotherapy Day. It's all over the world, and so it was an honor to have, to champion, or rather, it was an honor to host on behalf of the Association of Clinical and Academic Physiotherapists of Nigeria, the Oyo State chapter. And so, today the conversation goes on, and it will be quite interesting for us to, continue this conversation. Right, I've sent you an invite, Prof. Okay, I've sent you an invite. Dr. Odole, I've also sent you an invite. Please do check your message. Try and see if you can get that. Okay, I have Professor Aderonke and I have both Dr. Odole, on the feed. Dr. Odole, you want to get settled? Can you hear me?
Yes, I can, perfectly.
Can you hear me? Okay, Professor Aderonke, we missed you yesterday on Twitter Space, but it's so glad that we can have you join us today. And I'm sure we're going to have a robust conversation today. All right, I'd like to introduce, in case you will be joining this feed much later, and because I would also be posting to my channel on YouTube. So in case you'll be joining this conversation much later, you would like to know, I guess, on today as we, in commemoration of the World Physiotherapy Day. Okay, so today is more like in continuation to the conversation we were having yesterday. I'd like to introduce my first guest, Professor Aderonke.Akinpelu. She is a professor of physiotherapy at the Department of Physiotherapy College of Medicine, University of Ibadan. And she is right on this feed with us. And also, Dr. Adesola Odole, an associate professor of physiotherapy, and she is also jobbing as the HOD Department of Physiotherapy College of Medicine, University of Lagos. So you're both welcome. And
you said Lagos, University of Ibadan.
Pardon?
She's from
you said Lagos.
University of Ibadan.
Yes.
Oh, did I say Lagos? Oh, I'm sorry about that. Of course, College of Medicine, University of Ibadan. Oh, I never thought I said Lagos. Okay, that's fine. Apologies about that. Okay, well, I had said in my introduction that yesterday was the World Physiotherapy Day, and this year's theme is centered on osteoarthritis and also the role of physiotherapists in the management and prevention of osteoarthritis. I'm going to start with you, Professor Aderonke.Akinpelu. Give us the background to this year's theme. Why are we concentrating or taking a focus on osteoarthritis?
Yes, I can hear you.
For this year. Can you hear me?
Good evening, everybody.
Right. So I'd like you to give us a background to this year's theme. Why the focus on
problem all over the world.
All right, I think there was a bit of network, fluctuation.
Okay, so
right
it affects,
so please go ahead.
people, many people, and it causes severe pain and disability. It reduces the quality of life of adults, and that is why we're focusing on osteoarthritis. Every year, the World Physiotherapy comes up with a theme of that is important to the public, and we want to improve the awareness of the public on such issues. So what this year it is on osteoarthritis because it affects many people. The prevalence is very high, and it affects both sexes, and it starts from age 40, and it affects many people. Osteoarthritis is a degenerative disease of movable joints, and in temperate countries it affects the joint of the fingers of the knee, but in Nigeria and most tropical world, it affects mostly the joints of the knee and the hip, followed by the shoulder joint. So it is a problem because in old age, it reduces the level of activities of people, and when their level of activity is reduced, then other ailments will come in. So that is why we are focusing on it. It is a degenerative disease of the movable joint, and it causes pain, and it limits functional ability because all the structures of the joint are affected. I don't know if I can go on. The problem starts with the cartilage. Where you have two bones coming, there is a padding on the two ends of that covers the ends of the bones forming the joint. This cartilage allows movement to be friction-free, to be smooth and painless. But when the cartilage begins to break down, then movements of the joint will become painful, and the pain will the destroyed cartilage will now fall on the membrane that envelopes the two bones, and it will cause inflammation. And when there is inflammation, there will be pain. And the other soft tissues, the other structured ligament, and other structures in the joint will guard. It's a natural thing that when there is pain, the structures around where you have the pain want to guard to limit the pain. But unfortunately, the guarding also increases the pain, and the muscles around will also guard. They will not relax very well, and with time, even the bone structure will change. So the whole every part of the bone structure will get eventually affected. So, and it's a chronic problem. It doesn't come and go. It continues to get worse and worse unless something is done. So people need to get properly informed about what osteoarthritis is.
Okay.
It is a type of arthritis. There are many other types of arthritis. So people need to be well informed about osteoarthritis.
Okay. When we say other types of arthritis, I sometimes I get confused myself, with the term osteoarthritis, and you hear people say arthritis. What is most common to us is the usage of the word arthritis. and we just know that, you know, it affects the knee, you know, the thigh. I'd like to come to you, Dr. Odole. How do we know what we are talking about here? How do we help, you know, someone who is probably a layman like myself to understand, are there differences between osteoarthritis and arthritis
Thank
itself?
you, Lady Gwen. Good evening, everyone. I'm happy to be in this space at this point in time. Thank you, my senior, Professor Akinpelu. Yes, there are different types of arthritis. You know, when we talk about arthritis, we're just talking about inflammation of the joints. But the word osteo limits it to a kind of arthritis that has to do with it has to do with the joints precisely. But you know, there are different things, there are different causes of the inflammation at the joints. We have what we call rheumatoid arthritis. We have gouty arthritis. We have different types of arthritis. But out of all these different types of arthritis, it is osteoarthritis that is the most common. We also have juvenile arthritis. There are so many types of arthritis. You know, so the word arthritis is just an umbrella word that talks about inflammation at the joints. Okay, so, and there are different features. You know, there are different things that you will get to do to be able to arrive at the diagnosis of these different types of arthritis. So if we are going to narrow it down to osteoarthritis, that is the focus of today's discussion. Osteoarthritis presents with pain. Pain is the major reason why people seek medical attention. So when you begin to have pain in the joints, okay, and excuse me, and for osteoarthritis, like Prof said, when you are 45 years and above, you have the tendency of having these osteoarthritis. You have the tendency of having these cartilage thinning, you know, cartilage destruction that will now bring about pain and inflammation. Then again, when you wake up in the morning and you have this joint stiffness, we always call it early morning joint stiffness. And this stiffness is lasts for not more than 30 minutes. Okay, you begin to say, oh, probably, you know, you could have osteoarthritis. Then sometimes again, when you are moving, usually the pain in osteoarthritis is usually activity related. It is activity related. When you begin to have pain, for instance, you are climbing the stairs and you now begin to have pain, or you are squatting and you're not having pain, you should look inwards to see your professionals to make a proper diagnosis of whether you have osteoarthritis. There are ways of even for individuals, because what we are moving into basically is that we want our clients, our patients to be aware. We want them, because when they are aware of some of the things that they present with, it will also help them to seek medical attention promptly. So if you are an individual, you have had a previous injury or trauma, maybe you were seated in a car and a vehicle now hits your car and you now hit your knee against a structure that now brings about pain. So if you have had prior injury to your knee, I'm talking about the knee now, please pardon me, because we need to narrow down. We cannot talk about everything about osteoarthritis in this 1 hour that we have. So we are focusing on the most common joint. The most common joint that is affected by osteoarthritis is the knee joint. The knee joint is a weight-bearing joint. So that is why it is mostly affected. So for instance, maybe a young person that is playing soccer, and in the course of playing soccer, you now have an injury, whether a minor injury, whether a major injury, or you have trauma to your knee. If that person is maybe between the age of 20 to 25, if that injury is not well managed, it is most probable that by the time the person gets to the age of 40 and above, 45 and above, the person could have osteoarthritis of the knee. The other types of osteoarthritis are not within the domain, but I just want us to know that there are different types of arthritis. Like I said, there is gouty, there is rheumatoid arthritis. We have systemic lupus erythematosus, And we have juvenile arthritis too. There are different types of arthritis. But out of all these different types of arthritis, the most common is osteoarthritis.
Right. Okay. I'm trying to. I know that for you medics, you normally have maybe skeletal, figures where you can show off. But I think from what Prof was trying to define, as the wear and tear to the cartilage, would mean that, let's say this is your knee, Prof. In case, I don't know if you have something like that you can show us, maybe, because I think you're still in the office or something. So if you have, you could quickly bring it, and if you don't, but that's fine. But if you could help us to understand it perfectly. So this is your knee, or your kneecap or your knee bone, and then you have something like that, right? And this is wearing off. Please explain that to me properly so that we get a true picture of what we're talking about.
Let me describe what we mean by the cartilage. When you take the thigh of the what we call chicken lap in Nigeria, and you eat it, and you strip it of all the flesh, and you get to one of the bones, you will see that there is a whitish material that covers the end. Yes. That's the cartilage.
Rubber
now, the cartilage
like
does
that,
not have direct blood supply. It does not have nerve supply. But you see, when you have the two bones together, there is an envelope. We call it synovial membrane. And inside that covers the envelopes, the two bones forming the joint. And inside the envelope, there's a fluid called synovial fluid. That fluid is what supplies the cartilage with the nutrients that it needs to keep going. But as we grow older, the body is not able to supply the cartilage adequate nutrients. In fact, the fluid may dry up, especially when we are not very active. And then that leads to the breakdown of the cartilage. It comes like powder, or flakes, and it falls on the synovial membrane, that envelope, the membrane that houses or covers the bones, and then the inflammation starts. That is the problem. And you see, it is not the wear and tear of the body occurs everywhere in the body. I'm sure if you take like 100 children, you probably will find like 5 children using a pair of glasses. But when you take 100 adults who are 40 years and above, you probably find 20 of them not using glasses. So it's like what is happening. It's like also the blood pressure. You won't find high blood pressure in young people, most young people. But in adults, when you are going there, the system that keeps the blood pressure at what we consider, what is accepted as normal level, will become insufficient, and the blood pressure will now start to rise. So the wear and tear of the cartilage of the joint is not peculiar to the joint alone. It takes place in all parts of the body. So we call it osteoarthritis in the joints. And then one peculiar way you can know that it is arthritis, that when you move the joint, the movement will not be smooth again. It will feel rough. And when it is severe, you even hear the cracking. We call it crepitus. It cracks, and that confirms that it is osteoarthritis. It is very peculiar to osteoarthritis.
because I once, had that issue, and which Dr. Odole knows a bit of my medical history in that regard. And let me give you, I know it might make you to laugh. The kind of
Yes.
sound you hear is like crack, crack, crack. No, but it just feels like a shaft, that you like, I don't know how to describe that, but the best way to describe it is just say it just says crack, crack, that, like, that's just the best way to describe the sound. And then, sometimes when you're trying to climb the stairs, you have lots and loads of pain. That's indescribable pain, that you're like, oh my goodness. Okay, still talking about, osteoarthritis. Let me come to you, Dr. Odole. How can we prevent this cartilage that we don't even respect, we don't even see, we don't even honor the cartilage, we don't even give a damn about this cartilage, but here it is a problem to our health. So how can we pay more attention? What are the things, maybe are there foods, are there things we need to do, to care
Okay.
for our
Thank you.
osteo
Yes.
health?
Basically, I talked about, when I was talking about things that can, or how you can arrive at a diagnosis of osteoarthritis, I mentioned that if somebody has had a prior injury to the knee, so one thing that you should avoid is that you should avoid any form of injury, whether you are a child, you're an adult, you're an adult, you are whatever. You should, because for the risk factors of osteoarthritis, we have what we call the modifiable risk factors. We have the non-modifiable risk factors. The modifiable risk factors are the ones that you as a person, you have control over. You should avoid. Even though they are risk factors, but you can do something about it. One of such risk factors is obesity. You should avoid being obese, because obesity is one of the predisposing factors to having osteoarthritis. So if you are talking about preventing it, another thing again, regular exercise. Prof said something about inactivity when she was trying to describe what osteoarthritis actually means. If you are an individual that you engage in regular exercise, that means you want to lower the risk of you having OA, of you having fall. We are looking at older not adulthood. We are looking at the older phase of life when you talk about the older adults. So because we know that osteoarthritis, the risk becomes higher as one gets older. So, and we know that we all want to get older. Nobody wants to live and die young. So because you want to live, you want to get older, you should engage in regular exercise before you get to that age of 180 by God's grace, 120, 140. So if you don't want to develop osteoarthritis, even though we know that there is a tendency for one to develop osteoarthritis in old age, you should engage in regular exercise, because even that regular exercise will also prevent you from having fall, will also prevent you from having injuries to the knee. So regular exercise is one way of preventing the development of osteoarthritis. Weight loss, very, very important. In these days, days and time, when people think that when you are big is a sign of affluence, and you see even in childhood, you see children, severely obese. It is not something to delight in. It is something that we should work in, because obesity or overweight makes you stand the risk of developing osteoarthritis. So if you want to prevent osteoarthritis, please, I beg of you, try and control your weight so that you have lower chance of developing it in old age. So you prevent joint injuries, you do a lot of exercise, you work on your weight, and then, okay, those are the modifiable factors. The other ones are things that you don't have control of. The other risk factors, being a female, nobody chooses his or her sex. They just give birth to you and you find out that you are a male, you are a female. So we cannot modify that. We cannot modify being a female. So the only thing that we can modify is that as female, because there is that tendency for us to have fatty deposits at different parts of our bodies. So you want to guide against that. And that is still talking about obesity and being overweight. I think those are the areas where you can prevent the development of osteoarthritis. I don't know if Prof wants to add one or two things. So that's
okay. Thank you very much. Apart from obesity and overweight being risk factors, I want to state that when you have osteoarthritis and you are obese, you even have worse disease because there is a lot of pressure on the joints of the lower limbs. Well, osteoarthritis in the hospital, our hospital-based data show that it is more common in women. I think it is just because more women report in the hospital. Our data, community-based data, tells us that it's about the same. The difference is not so much, but men tend not to report in the hospital early. But maybe they don't have as severe. It appears that when women reach menopause, okay, the guard against degeneration of the cartilage and the joint generally reduces, and that is why they tend to have it. More women have it more than men. Let me also say one thing that many doctors do not agree with, but I'm a live evidence of the effectiveness of this. You see, the ingredient I talked about, nutrients in the joint, nutrients in the synovial joint. One of the nutrients is called
chondroitin sulfate and glucosamine.
Yes, chondroitin. Thank you. And what's the other one?
Glucosamine.
Glucosamine. They are usually combined. When the moment you start, you know that osteoarthritis runs in your family, and you begin to feel pain in your joints very early, very, very early. And you begin to use this glucosamine and chondroitin. They help the tablets, you have the two combined, they help to slow down the rate of cartilage deterioration. When it is well established, they don't work because the degeneration has gone beyond what they can slow down. But at the early stage, I started using this the food supplement, the tablets in the food supplement.
Yeah.
And I started using it since 2001, and I use it every day. I also use, we also discovered there was a study that was carried out by an orthopedist in UCH, and he compared the biochemical profile of people whose X-ray films show that they have arthritis, but there's a group that do not manifest any pain, and there's another group that experiences pain. And the difference in them was that there are what we call free radicals in the people that have pain. So the recommendation is that we should use what do you call it?
The supplements.
Antioxidants. And one of the best antioxidants is vitamin C. So I combine glucosamine chondroitin tablet with vitamin C, and some people also recommend fish oil. So when you use those as food supplement along with your usual diet, they help too. But many doctors don't agree. But I have been using it daily, and I know that if I take X-ray, there will be sign of osteoarthritis. But I know that it has slowed down the rate of it. I have never had to see any doctor, for osteoarthritis. But it runs like I don't know, in my family. That's my mother's side.
Wow.
They don't have high blood pressure, but osteoarthritis is the problem in the family.
Okay, so from what you've just said, apparently osteoarthritis, can be hereditary.
Yeah.
Yes, very much.
Yeah.
It can
Okay.
be.
Yeah.
Okay, so you're saying the moment you know that, okay, that person in the family lineage has osteoarthritis, the best or the earliest thing for you to do, not to wait for the pain or not to wait for the manifestation of it, and to start, taking some of the supplements to fortify the immunization of your health.
Yes.
Fantastic. Okay,
But
so
we are not saying that it is hereditary in all people, but it seems to run in some families, not all. But anybody can have it. Anybody. And it does not mean that if you have it, your children will automatically have it. But some people, you see, grandmother, mother, auntie, then you need to be more careful.
okay, Dr. Odole, we've kind of started in a way with Prof telling us about the preventive measures, the simple things we can do. Are there cure for osteoarthritis to start with?
Okay, thank you. If a diagnosis of osteoarthritis has been made, that diagnosis is there. It's not as if, today we make a diagnosis of osteoarthritis. When you come back after therapy in another 5 months, they will now say, oh no, this person does not have osteoarthritis again. No. What is being managed? We want to manage the progression of the disease. Because, like Prof said, osteoarthritis is a degenerative joint disease. It is a disease. In fact, I always liken it to like a failure of an organ, because the knee joint as itself is like an organ. Just like when we talk about organs of the body, it's an organ that should be taken care of. It can fail. It can fail when the destruction is so severe, is so much. It can fail such that you can actually replace the whole joint. Just like we replace organs in the body. Like if somebody has a problem with the kidney, we say, oh, the kidney has failed. Let us replace it. Let us look for somebody, a replacement for the kidney. In the same way, we can look for a replacement for the knee joint. So if you are diagnosed as having osteoarthritis, you have it. But it is not something to be worried about in terms of the diagnosis, because it can be managed. Osteoarthritis can be managed. That is, so we're not saying a cure, so to speak, but we are saying that it can be managed, because anybody that develops osteoarthritis presents with pain. So when you present with pain, your pain can be managed. Okay? When you present very early, from all our discussion, this conversation, it is most appropriate that you don't wait for the pain to be limiting before you present to your healthcare professional. So your pain can be managed. And what is the essence of living? If pain can be managed and you're able to move about and you're able to carry out normal activities of daily living, and you're able to live as near normal as possible in terms of functional activities, okay? You don't necessarily have to begin to bother about the diagnosis of osteoarthritis. Just like when we talk about hypertension, we have so many people that are living with hypertension. Okay, the diagnosis is there, but they are living well. And like I said, no, I've not talked about it today. like Prof was talking about, I think she mentioned something about X-ray. You can have somebody's X-ray saying that this person has severe osteoarthritis from the X-ray. By the time you look at the bony spores, like that Prof mentioned, the osteophytes, we call it bony spores, like thorns, you know, like outgrowths that looks like thorns, egun in Yoruba, you know, in the joints. And you now have the joint space. You know, Prof was talking about the two bones. The midseam of two bones is what we call the joints. So, and in between the two bones, there is a distance. But when somebody begins to have osteoarthritis, like Prof mentioned, and the cartilage begins to thin out, it begins to break, it begins to, there's degeneration. The two bones will now begin to meet each other. So the joint space between the two bones becomes narrowed. You will find all of these in the X-ray. You will find these osteophytes, you find the cartilage destruction, you find sclerosis, those are medical terms. But despite the fact that you have all of these features in the X-ray, you can be very surprised. It's so surprising that sometimes, again, those people that have severe might not even present with so much pain as those whose radiographs are saying that, oh, from all of these radiographs, from all of the features in this radiograph, we are going to say that, oh, this person has mild osteoarthritis. So there is no strong correlation between what you have in the X-ray. So what am I trying to say? That the diagnosis is there, severe osteoarthritis, but the symptoms are not so disturbing. So we are not talking about the cure of the degenerative joint disease, because even the cause of this degenerative joint disease, we do not know. So that is why we are playing safe and saying risk factors. We are saying predisposing factors. So we need not worry about the cure. What we should be concerned about is managing the presentation so that one can live a healthy life that is devoid of functional limitations, and that would make for quality, that will make for excellent health-related quality of life. That is all.
Oh, okay, Prof.
Yeah.
Let me ask you this. We've started talking about management. Once you're diagnosed, there is no cure, but a management that will give you an effective management. How do we manage osteoarthritis? And I see Awoniyi Olusola on the feed. Awoniyi Olusola, if you're in a good place, I'd like to bring you on maybe towards the end, you know, and for you to share probably your experience with patients, you know, that come into your clinic or into your hospital to complain of osteoarthritis. What are the things that you notice about people behavior towards osteoarthritis as patients? Okay, so if you're in a good place, help me to find a good place, you know, for you to talk to us. I'd like to bring you on a little at the end of this program. Okay, so Prof, I was asking once again that we started talking about the management of osteoarthritis. What are the basic management, you know, you would prescribe?
Thank you very much. Thank you very much. The basic management includes preserving the range of motion, that is reducing stiffness. We must make sure that the joint can be moved fully. Then we want to relieve the pain. With physiotherapy, we have many modalities that we can use to relieve the pain. That does not exclude drugs, which is drugs that are normally prescribed by doctors. Although in some countries, like in the UK, physiotherapists who are specialized in musculoskeletal area are allowed to prescribe some drugs, but not in Nigeria. Then we want to strengthen muscles. I said the muscle will guard and they will not function well, and they begin to lose their strength. So strengthen the muscles, increase or preserve the range of motion of the joint, and train functions provide the patient with some devices that can help them to function well. Sometimes the problem could be a problem of putting weight, that is weight bearing on the joint. Then you can advise the patient to wear some support on the knee, for instance, and use walking stick or cane to relieve weight on the joint. So those are, and then generally we want also to improve the level of physical fitness of the patient. They tend to slow down because of the pain, and you must give appropriate exercises. When the joints of the lower limbs are affected, we advise, we prescribe, physiotherapists prescribe appropriate exercises. We want to minimize exercises that have high impact on the joint, like jogging. So we advise them on the appropriate exercises that can improve their heart and blood system health, as well as the health of the joint. So those are the things that we can do to manage osteoarthritis.
Okay, it's still talking about what you just mentioned now, because once you have issues with your osteo, with your weight loss, people just say jog, just jog, and exercise, join the gym. So, and here you are, you're saying the solution is it has to be a prescriptive form of exercise, and jogging does not necessarily solve osteoarthritis. Is that what you're saying?
If it is in the knee joint or hip joint. If you have osteoarthritis in the shoulder joint, you can jog. But when it affects the joints of the lower limbs, jogging or skipping, anything that will make you to jump up and land heavily on your joint will make the pain worse. Yes, will make the joint.
Wow.
Walking is good, but long walking, like you walk 6 kilometers, will also increase the pain. So we advise that they walk short distances, but they can walk more frequently.
Wow, fantastic. I did ask this question when we were on Twitter Space, Dr. Odole, and I'm going to go across board with you and Prof to say, between pharmaceutical medication, traditional medicine, physiotherapy, how would you recommend, in your own opinion, to be the best way of managing osteoarthritis? Let me start with you, Dr. Odole.
Okay, thank you. Yes, I'm going to talk about medications and physiotherapy. And I will speak briefly about the use of traditional medications. Evidence has shown that medications actually has a role to play, okay, in the management of osteoarthritis. Usually, when people report to the clinic, because we tend to cope with pain, so we don't report to the clinic early enough. And by the time people report to the clinic with severe pain, they would have to be on medications. Okay, they would have to start with medication. So we now have a combination of medications and physiotherapy. But if a patient reports very early and the patient's intensity, the severity of the pain is mild, the patient can go with physiotherapy straight away, because physiotherapists are also pain managers. We have different things that we use to manage pain, whether it is at the acute level or it is at the chronic phase, okay, of the injury. We manage pain very well. And the good thing about the pain that we manage in physiotherapy is that we do not have side effects. Okay, there are no side effects in the interventions that we provide to our clients and our patients. So if a patient has severe pain that is limiting, for instance, somebody is the breadwinner, the person has to go to work, and you have so much pain that you cannot cope with, it is better you go on your medications so that the medications would help to retard the rate of inflammation very fast. Okay, so after the slowing down of the inflammatory whatever events, the patient can now be referred for physiotherapy. So medications and physiotherapy are very important in the management of osteoarthritis. The only thing again is that it is not because I am biased as a physiotherapist. I think that based on evidence, because of the other things that patients present with, it is not just about the pain. Prof has talked about muscle weakness, joint stiffness. All of those things are still things that we still have to manage. Okay, and because we have to manage pain alongside all of these other features, it is best that patients are referred for physiotherapy early enough. Because if you say that, oh, you want to manage only pain, and the pain subsides, and the individual has weakness in the joint, so how are we going to manage that? And the early intervention is best in the prevention of joint stiffness. Because by the time a joint becomes stiff, we would still now go back to where we are coming from. That pain that we think we have managed successfully would now be provoked, and the patient would not have pain again for us to get the patient to be able to move the joint. So for traditional medicine, I have not used any of that, but I have heard people say that, since we are talking about reports from patients, evidence from scientific research based on the scope of research that I conduct has not shown me that these traditional medications actually work. But I know that it could work. So I'm not throwing them out outrightly. This is personal to me. I'm not throwing them out outrightly. I know that some patients have said that they've used this, they've used that, and it has worked for them. Even though we have not been able to put all of their this evidence into science to make it scientific evidence. They are just anecdotal evidence. They are just things that we hear people say. So I cannot speak to it, as a scientist, as a researcher, as a physiotherapist. I cannot speak to that in full.
All right, over to you, Prof. What is your opinion in this regard? Talking about pharmaceutical medication, traditional physiotherapy management of osteoarthritis. What would be your take?
Yes, thank you. The pharmaceutical preparations, that is, the drugs are necessary. So they should be combined with physiotherapy. That is basic. For the traditional drugs, so the problem is what dose. We are not sure of the content. When you buy from A and you buy from B, the content of what you are buying is not the same.
They vary.
As the second one, and we are not sure of the dose. I only wish that researchers, especially the pharmacy researchers, can help us in this area. And our traditional, I don't know what we call them, people are not very open. They won't tell you everything that they are combining. So that is the problem. The Chinese are open about their own drugs, and that is why they have been able to move forward. But that's the problem. And I'm afraid we are having more cases of kidney failure because people take all sorts of concussion that maybe, I'm not 100% sure, maybe contributing to kidney failure in the population. So we need to be very careful. I'm not condemning the traditional medicine 100%, but I'm just explaining the problems associated with them. If you buy paracetamol from 8 pharmacy shops, you are sure that they are the same most of the time. But when you go to this traditional medicine man, he gives you something you are not sure it's the same thing. And we need to actually work on it to make sure that the patients are satisfied. And we need to be very careful. I'm not condemning the traditional medicine 100%, but I'm just explaining the problems associated with them. If you buy paracetamol from 8 pharmacy shops, you are sure that they are the same most of the time. But when you go to this traditional medicine man, he gives you something you are not sure it's the same thing. And we need to actually work on it to make sure that when we say traditional osteoarthritis drug, that it is one type, but we don't have that yet. So that's my reservation about traditional drugs.
Right, and I think it does make sense. I wish, we are a country where, because some of these things actually work, but you see the dose, the content, or because some of those herbal or traditional medicine, they are chemicals. They are chemicals, but in what form and what is the name of the chemical? Those are the things that scientists need to research. And I wish that Nigeria will wake up, to some of those things, because it will make medication cheaper. In that regard, I want to believe. I don't know, because of our time, I wouldn't want Instagram to knock us out. But I'm trying to see if I can get Mr. Awoniyi. But if I can't, I'd like us to probably share our last. Mr. Awoniyi, I've sent you an invite. So if you can see, the invite, please do. Great. Okay, great. Quickly, Mr. Awoniyi, I'd like you to express or explain to us, when people come to your clinic, do they present themselves at the early stage, or when at the later stage? What is Nigerians' disposition to osteoarthritis when they come to your clinic? I can see you're having a bit of network problem, but in case you can hear me, do attend to that. But when you come back. Okay, I think he's having a problem, with his network. All right. So, but before we go, I'd like you to start with you, Dr. Odole. What would be your final word to us or to people watching this feed today? What would be your final word?
Okay, thank you. My final word would be that if you are experiencing all of those things that we have mentioned in this conversation, if you are experiencing some of the things that we have mentioned in this conversation, that is that could be disposed. Mr. Awoniyi, can you mute, please? Mr. Awoniyi, please mute. Okay, thank you. I was just saying that my final word would be that if you are experiencing pain in your knee, if you are over 45 years old, if you have had prior injury to your knee, if you are a female, if you are obese, please try and get to see the exercise experts, because exercise is medicine. Exercise is medicine, just like you take oral medications. Exercise is cheap, it is free, it does not have any side effects. Exercise can be used to prevent the onset of osteoarthritis. It can also be used in the management of osteoarthritis, though you have to see your physiotherapist to know the right dosage. It has to be prescribed to you. Like Prof said, you cannot just go in any form of exercise. Exercise has to be prescribed. And for you, for only, it's just that you are not too sure, just around the corner, you will get a physiotherapy clinic, and that would attend to your needs. We don't want you to live with a disability, because we want to help out as exercise experts. Exercise is life. Movement is life.
Okay.
Thank you.
Because I don't want Instagram to cut us off and for us to come back. Mr. Awoniyi, before I come to Professor, tell us your experience with Nigerians and osteoarthritis when they come to your clinic. In just 1 minute, if you can do that.
Okay. Thank you so much. It has been a fantastic experience, though we usually have late reports at the hospitals. People hardly come to the hospital at the earliest stage. It is when they have difficulties in walking or the deformity might have set in that they normally report. Had it been people come to the clinics earlier enough, then we could be having fantastic outcomes. But in most cases, it is when they have difficulties with their walking or deformity is setting in. Some people are even having genufag or scale leg before they will report. So, but by and large, it has been a very good experience. At least people get relieved, symptoms subside, functions being restored gradually, and they could perform ADL with little difficulties. So it has
What
been
is
a good
ADL?
activities of daily living.
Right. Okay. All right. So, Prof, over to you in just a minute before we wrap up.
Well,
What would be your last? What would be your?
Yes, is that osteoarthritis is not a disease to be ashamed of. It is a disease of old age, like other parts, and people should come out and seek help early. When they're advised to use walking aids, they should not be ashamed. It is not giving into the disease. It is to help them. And lastly, when it gets so severe and bone is touching bone and surgery is recommended, they should please give consent to go for surgery. And after the surgery, they will also need physiotherapy. Please. Some people insist, I want to go to my God the way I came to this world. It is outdated. Please, you need good quality of life, and God has released knowledge to human beings to help ourselves. So they should just take it and go for surgery when it is necessary. That's my advice to everybody.
Okay. Well, I like to share these statistics. Hopefully, Dr. Odole's network comes back because I think she's using the Wi-Fi. All right. It says studies have shown that 520 million people around the world have osteoarthritis, and that's where Prof was saying earlier on that lots and lots of people, 520 million people around the world, is a great number, and 48% increase in number of people affected globally with osteoarthritis from 1990 to 2019. 48%. And osteoarthritis is a leading cause of disability. I want to appreciate every one of us, and once again, in case you're joining us, one way or the other, I would say to you, please see your doctor, see your physician, see your physiotherapist to manage your condition. I'm trying to get Dr. Odole to come back again, okay? All right, see your physician and see your doctors and all of that. First of all, one of our speakers, an erudite speaker, Professor Aderonke.Akinpelu. She's a professor of physiotherapy at the Department of Physiotherapy, College of Medicine, University of Ibadan. And of course, talking about the head of state, I was going to say the head of station, the head of department of physiotherapy, College of Medicine, University of Ibadan, is Dr. Adesola Odole, who's been enough to join Awoniyi Olusola from Odolakun. From the chapter of the
Back.
The communication. Dr. Odole, before internet just messes us up, how can people reach your association how can people get, the contact of your association if they need help?
Okay, good. Good enough. We have Mr. Shola Awoniyi is the secretary of the Oyo State chapter of the Association of Clinical and Academic Physiotherapists. So maybe he will speak to that. But if you want to get in touch with either Professor Akinpelu and myself, we are at UCH. UCH is a very major landmark in Ibadan. When you get into UCH and you ask for the Department of Physiotherapy, College of Medicine, we have the department in the UCH, but we are from the College of Medicine, even though we are also consultants to the UCH. But our offices are located in the College of Medicine. You can always get us there. For those that are not in Ibadan, okay, you can reach out to us on email. I can provide my email address, and I can also provide Prof's email address. Then Mr. Awoniyi will give us the number as the secretary. My email address is Adesola, no H, Adesola, I'll type it, Adesola _Odole @yahoo.com. Professor Akinpelu's email address is Ronke.Akinpelu @gmail.com. So if you cannot get my own very well because of the underscore, Professor Akinpelu's own is Ronke.Akinpelu @gmail.com. Okay, so Mr. Awoniyi, you can give us your number since you are the secretary of the Oyo State chapter. Thank you.
Mr. Awoniyi.
Okay, my yes. Well, my contact number is 090 7356 6100. 090 7356 6100.
Fantastic. Okay, so this is where we'll be calling it a wrap. Once again, we've been marking the World Physiotherapy Day, which comes up every year for 2022. It's been about the awareness of osteoarthritis and the role of physiotherapists in its prevention and management. And we also hope that you benefited from this conversation. Remember that this is not Let's Talk with Lady Going, but it's this particular conversation is being championed by the Association of Clinical and Academic Physiotherapists of Nigeria, the Oyo State chapter, and is being led by Dr. Adesola Odole. And of course, we've had Professor Aderonke.Akinpelu and the state's chapter secretary, in person of physiotherapist Awoniyi Olusola. Thank you very much, and do have yourself a good night to rest. God bless you. Remember, we'll be coming, some other time with Let's Talk with Lady Gwen. We all want to say bye-bye.
Bye.
Yes,
Bye.
bye-bye. Thank you, Lady Gwen. Thank you.
Thank you so much. Thank you.
Thank you very much.
Bye.
Bye.